Greetings everyone, my name is Sean, and welcome to my channel, Time for Evolution. This video series intends to make important academic research articles more accessible to the public. Join me in this quest for knowledge.
A brief history of the origins of bio-psychiatric treatments. 1. Orientated psychiatry exists within one huge contradiction. 1. On one hand, psychiatrists supporting this position firmly believe that such disorders as schizophrenia, mania, depression, OCD, ADHD, and more are biological diseases. Cummings, 1996. Koplovich, 1996. 2. In a consensus conference sponsored by the National Institutes of Health, NIH, in November of 1998, the panel of experts concluded there are no data to indicate that ADHD is due to a brain malfunction, PI2. 3. In their report, they went on to state that the same could be said for most psychiatric disorders, including disabling diseases such as schizophrenia, PT2. 4. A short historical look at psychiatry will help to answer both the why and the how, giving additional credence to the fact that a biological basis for mental illness does not exist. 5. To accomplish this goal, I will explore the following 5 important periods in the history of psychiatry from the 17th century on Period 1. The development of institutions for the care of the insane, 1600–1800. Period 1. The development of institutions for the care of the insane. 1. Prior to institutional residency, the insane were generally cared for by family members or by members of the small rural communities in which they lived. 2. In 1656, a royal edict created an institution in Paris called the General Hospital to deal with people who were perceived as a burden to society. 3. This administrative system was soon responsible for several institutions, including one facility for insane men called Bicêtre, and another for insane women called Salpêtrière. 4. People able to provide for themselves were returned to society. 5. This meant that the insane, because they were supposedly unteachable, unreachable, and incapable, were never released. 6. The cells of the mad were usually dark, cold, and rat-infested. 7. It was not uncommon for both men and women to be left lying naked in their own excrement on beds of rotten straw. 8. In England, and later the United States, attempts were made to house vagrants and deviants in almshouses, houses of correction, charity hospitals, and/or workhouses. 9. It was during this period, the 18th century, that private madhouses first appeared. 10. The few that were built did not provide appreciably better living conditions than those offered by the private madhouses. Period 2. The moral management programs. 1. In the late 1700s, conditions of the asylums had reached their most deplorable state. 2. The following is one of the clearest examples of individual psychotherapy practiced by a moral management advocate, Dr. John Butler, at the Boston State Hospital from 1839 to 1842. 3. It was his common practice to dig deep into the family and personal history of his patients to establish, if possible, a connection between their mental disorder and some previous accident or error in their lives. 4. Bockhoven, 1956, in his report on the Moral Management Program at Worcester State Hospital in Massachusetts, provided the following success data. During the entire 20 years, there were 2,267 such admissions, of whom 1,618 were discharged as recovered or improved, or 71%, 66% recovered, 5% improved. 5. It was during this time period that psychiatry began to take control of the asylums. Period 3. The takeover by psychiatry. 1. Psychiatry had its beginnings at the height of the success of the non-medical moral management program. 2. The result, according to William Bynum, 1964, a historian specializing in this era, was a growing public recognition of medical jurisdiction over insanity. 3. It was at this time that physicians began to describe insanity as a medical disease. 4. According to Boyle, 1990, moral management explicitly denied medicine's effectiveness regarding the mentally ill and attempted to remove medical powers of inspection granted under the 1774 Act. 4. A struggle ensued as physicians feared that the reformers would put newly built institutions into the hands of lay people, thereby reducing doctors to a subordinate role. 5. By the middle of the 19th century, the medical profession had assumed control of most public asylums in England and the United States. 6. This was further accomplished by assigning physicians oriented to medical treatment to vacant superintendent posts instead of those skilled in moral management techniques. 7. Toward the end of this period, organized psychiatry began work to categorize the behaviors associated with madness into disease syndromes. Period 4. Kraepelin and the establishment of modern psychiatry. 1. The modern era of psychiatry began in 1883 with the publication of Textbook on Psychiatry by the German psychiatrist Emil Kraepelin, 1856-1926. 2. Since most medical progress during this time started with an identification of the symptoms of a particular biological disease, it was only logical that anyone attempting to discover the biological origins of mental illness would follow the same pattern. 3. He labeled this condition as manic depressive insanity. 4. He noticed another syndrome consisting of teenage onset, hallucinations, delusions, general mental confusion, and deterioration over time, resulting in complete incapacity. 5. He labeled this group of symptoms as dementia praecox, which later became known as schizophrenia. 6. Once these syndromes were identified and published in Kraepelin's textbook, psychiatry assumed that they were brain diseases. 7. Psychiatry, it was claimed, had established madness as a medical disease. Period 5. The beginning of biological treatment. 1. The rest of medicine was marching forward with the identification of true biological diseases, such as embolism, jaundice, and degenerative lesions, including necrosis, gangrene, uremia, and diabetes. 2. In a paper delivered to the Second International Neurological Congress in 1935, John Fulton and his younger colleague, Carlyle Jacobson, explained that they were able to drastically alter the behavior of chimpanzees by destroying the frontal lobes of their brains. 3. Based on these findings, in 1935, Portuguese neurologist Egas Muniz introduced lobotomy as a treatment for mental illness. Pressman, 1988. 4. Joel Braslow, 1998, in his book Mental Ills and Bodily Cures, studied the records in California mental hospitals in an attempt to understand the way in which hydrotherapy was legitimized. 5. He declared that it was the first so-called treatment modality to replace the use of restraints. 6. In studying hydrotherapy and other abusive treatment modalities, such as shock therapy and lobotomy, Braslow drew an important conclusion. Once physicians believed that a control method was a medical treatment, they, after the fact, developed complex physiological explanations to justify its use. 7. The change in behavior did not result from some medical or biological correction, but because of her fear of a hellish procedure that caused horrifying seizures and the anticipated frightening sterilization procedure which would rob her of her femininity. The impact of biological treatments. 1. As difficult as it may be to fathom, this is roughly how every major biological treatment has been justified and made scientific, including the present use of psychotropic medications. 2. Malaria therapy, deep sleep, and the shock treatments represented the first independent therapies over which psychiatrists themselves disposed, p. 224. 3. This same realization motivated Louis Casamajor, 1943, a New York psychiatrist, to state, "One may question whether shock treatments do any good to the patients, but there can be no doubt that they have done an enormous amount of good to psychiatry," p. 607. 4. Each disease model for mental illness originated only after a new method of restraint for undesirable behavior had been developed. Summary of the history of biological psychiatry. 1. Below is a short summary of the major points surrounding biopsychiatry's attempt to validate a biological view of mental illness. 2. Mid-1800s, physicians became interested in the madhouse trade as a source of profit and status. 3. Knowing that their methods were not nearly as effective as those of the moral managers and fearing that they would be viewed as mere custodians of the insane, psychiatrists had to establish madness as a medical condition for which they possessed special skills. 4. Many applicable innovations in other branches of medicine were duplicated in the asylums, replacing the moral management techniques with a disease view of mental illness. 5. 1920 to the present. Any somatic intervention that had any sort of impact on the symptoms of mental illness was called a treatment. 6. Once an intervention was labeled a treatment, a theory was constructed to give credence to that treatment modality. 7. With the passage of time, each somatic intervention, including the use of psychotropic medications, came to be seen as nothing more than another form of restraint and control. Some concluding remarks. 1. If we care to be honest, bio-psychiatry has been able to exist over time, primarily as a fallacious medical profession with the main goal of the restraint and control of others. 2. These may be strong words, especially for those psychiatrists who are sincerely trying to help people. 3. This history lesson allows us to understand the truth with clearer vision. 4. Just as the other past methods were eventually understood as nothing more than the attempt to control a person's feelings, emotions, and behavior, this is exactly how we must view the use of psychiatric drugs. 5. In the field of biopsychiatry, history does repeat itself.